Hello, hello. My name is Jones, and today we are going to look at inflammation. Okay, so this is in the series in which we are looking at different surgery topics. Okay, so now we are looking at inflammation. Inflammation forms the basis of a lot of conditions that one may suffer from. So it is important that we know the processes that are involved within inflammation, the cells that are involved within inflammation, and all other mechanisms in which inflammation will occur. So, it is important that you are vested with the information about immunity, the cells that are involved in fighting infection. So, that is why we have to look at inflammation in this scheduled lesson. The objective of this lesson is you are supposed to define inflammation, state types of inflammation, explain causes of inflammation, describe the process of inflammation, and state signs and symptoms of inflammation. So those are the objectives of our lesson. So to begin our lesson, let us understand what the term process means. So the term process simply means a series of actions or steps towards achieving something. So when trying to appreciate inflammation, you need to know that it's a process, okay, or there is a process that is involved. So there is a series of action, there is a series of processes that needs to happen so that the inflammatory process can happen or may happen. So the word inflammation means a physiological process by which body tissues respond or react to injury or infection. So inflammation is a physiological process. Okay, physiological process that may happen because the body is responding to some noxious stimulus. So that is the inflammation. So it can occur in absence of infection, while infection cannot occur without the inflammation. And this makes it cardinal for us to cover this lesson. Okay, so what are some of the reasons as to why inflammation occurs? What are some of the reasons, or what is the purpose of inflammation? Okay, so the purpose of inflammation can be summarized or understood as firstly, for protection. So, within the process of inflammation, it will help to get rid from the body injurious stimulus that may result from necrotic cells and the tissues. And within the process of inflammation, it will also save to destroy, dilute, or ward off injurious agents and set in motion the process of repair. The other purpose of inflammation is repair. During repair, injured tissue is replaced by regeneration of cells or fibrous tissue. Types of inflammation. There are two main types of inflammation. There's acute inflammation and there's chronic inflammation. Okay, so we can start with by looking at acute inflammation. So what is meant by acute inflammation is that there is rapid response to an injurious agent that serves to deliver mediators of host defense, which are leukocytes and plasma proteins, to the site of injury for the immediate commencement of healing process or stoppage of bleeding. So, acute inflammation is about the immediate response of the body to a noxious stimulus. Okay, so acute inflammation is the immediate, okay, commencement of healing process. Okay, healing process because of exposure to noxious substance. This is in the process of stopping the effects that the noxious substance may cause. Okay, so we have defined acute inflammation. Then, what are some of the causes of acute inflammation. So, infections and microbial toxins may cause inflammation. Trauma, which can be blunt or penetrating, may cause inflammation. Physical and chemical agents. Examples here may include thermal injuries, burns. Okay, all these may cause inflammation. Foreign bodies also the body is going to react and there will be some inflammation. Then immune reaction. This will cause inflammation in that the swelling will come due to, for instance, if bitten by an insect, so the swelling will come because of the immune's reaction to the bite from an insect or bite from bees. Then the other type of inflammation is chronic inflammation. So chronic inflammation is simply inflammation that has got a longer duration and is associated histologically with the presence of lymphocytes and macrophages. The proliferation of blood vessels, fibrosis, and also tissue death. So these histologically is associated with chronic inflammation. So when you're talking of chronic inflammation, we're just looking at inflammation that is a little bit longer. And within this inflammation that is a little bit longer, you find that when you analyze, okay, analyze blood components, okay, you find that there will be presence of lymphocytes and the macrophages that are going to try to fight this infection. And then there's also proliferation of blood vessels, fibrosis and tissue death. Okay, other causes can be persistent infection by certain microorganisms such as Mycobacterium tuberculosis, Treponema pallidum. So TB bacteria may cause inflammation within the lungs, causing tuberculosis. So Mycobacterium tuberculosis will cause that. Treponema pallidum, respectively, it may cause syphilis. It may cause syphilis. With time, one may end up having complication of meningitis because of the effect of these bacteria. Prolonged exposure to potentially toxic agents, either exogenous or endogenous, may also bring about chronic inflammation. Autoimmunity. Immune reaction may develop against individuals' own tissues, leading to an autoimmune disease. The example here we can appreciate is rheumatoid disease. So, autoimmune infection may cause chronic inflammation. Prolonged exposure to a rough surface causing chronic friction. So, if one is exposed to a noxious substance or to a rough surface for a long period of time, it may result or complicate to chronic inflammation. Okay, so now let us make a comparison between acute inflammation and chronic inflammation. In appreciating this comparison, we are going to look at causative agent as a characteristic. We are going to look at major cells involved as one of the characteristics. We are going to look at onset as one of the characteristic in making comparison, duration, and also outcome. So, in terms of causative agents, acute inflammation may come because of pathogens, okay, or because of pathogens or injured tissues. Now, for chronic inflammation, this may come because of persistent acute inflammation that may be due to non-degradable pathogens, or chronic inflammation may come due to persistent foreign bodies or autoimmune reactions. Okay, then looking at major cells that are involved. Okay, major cells involved as a characteristic. When you look at acute inflammation, neutrophils, mononuclear cells are involved. But when we look at chronic inflammation, okay, so mononuclear cells are involved, macrophages are involved, lymphocytes are involved, and plasma cells are involved, and also fibroblasts. So you see that we have more of these defense mechanism cells involved in a chronic inflammation. Then, in terms of onset as a characteristic, in acute onset is immediate. In chronic onset is delayed. Then in terms of duration, acute is only for a few days, 3 days, 4 days, less than 2 weeks. You have inflammation. Whilst chronic is up to many months or years. So in terms of duration, mostly when something comes in acute, we are seeing the inflammation manifesting almost immediately. So anything less than 2 weeks, anything less than 6 months, that stops and patient gets healed completely. We are looking at that as acute. But something which will last more than 6 months, okay, then that one can be looked at as chronic inflammation. Then outcomes, in terms of outcomes as characteristic, acute resolution here, there will be resolution. Okay, after some time, after maybe home complex and other remedial measures of inflammation. Okay, or resolution can be that an abscess will form, or patient can have chronic inflammation. So chronicity may come in as a complication to acute inflammation. Then, in terms of chronic, inflammation outcome, there is tissue destruction and fibrosis. So the tissue become destructed, become necrotized, and then there will be fibrosis. Let us now look at the process of inflammation. It's important we understand the process that happens within inflammation. So the mechanism of inflammation is basically the same regardless of the injuring agents. The intensity of the response depends on the extent and the severity of injury and on the reactive capacity of the injured person. The inflammatory response can be divided into a vascular response, a cellular formation of exudate, and healing. So this gives us the stages or phases of the inflammatory process. Okay, so the first phase we look at is vascular response. After cell injury, arteries in the area briefly undergo transient vasoconstriction. After the release of histamine and other chemicals by the injured cells, the vessels will dilate. So the dilatation then results in hyperemia or redness. Increased hyperemia, blood, so hyperemia, or will bring about redness. Okay, then vasodilatation and chemical mediators will cause endothelial cell retraction, which increases capillary permeability. Movement of fluid from capillaries into tissue space is thus facilitated, initially composed of serous fluid. This inflammatory exudate later contains plasma proteins, primarily albumin. The proteins exert oncotic pressure that further draws fluid from the blood vessels. Okay, the tissue that then becomes edematous. As the plasma protein fibrinogen leaves the blood, it is activated to fibrin by products of injured cells. Fibrin strengthens a blood clot to trap bacteria, hence preventing the spread and thus also serving as a framework for the healing process or saving the formation of meshwork in the healing process. Okay, so the vascular changes will lead to exudation, passage of protein, which rich fluids into interstitial tissue. So there's fluid migration into interstitial tissues. This will result in protective antibodies entering the damaged tissue. It will occur as a result of increased capillary permeability, that is the vascular response, and increased capillary pressure, and also due to increased tissue osmotic or oncotic pressure. So there will be exudation. So exudation is one of those characteristics um, which we see in a vascular response to do with wound healing. Okay, the protein escape into interstitial space. So that is vascular response there. Then cellular response. Cellular response explains the response of white blood cells to injury or infection. Increased blood viscosity will be due to loss of protein, which protein rich fluid into interstitial tissue, reducing capillary blood flow, which leads to margination and neutrophils and monocytes. So, margination is simply the adhesion of white blood cells to the endothelial cells of blood vessels that occurs at the site of any injury during the early phase of inflammation. So, white blood cells line up or get attracted to the margins, okay, to the peripheries of these capillaries or these blood vessels in order to start forming a mesh or a wound framework that is going to prevent further bleeding. So neutrophils and monocytes move and adhere to the inner surface of the capillaries. So, and then in they move in what I would call an amoeboid fashion through the capillary wall. Okay, so now we also have, apart from margination, the movement of neutrophils and monocytes, okay, that move within the inner surface or the margins of the capillaries. We also have blood vessels that may move and other protein content that may move through the wall of the capillaries, okay, and attract neutrophils and monocytes to accumulate within these areas. So when blood vessels and other protein material um, pass through the vessel to go and start forming the healing process, fibrinogen, and the fibrous tissue that is needed. We call that diapedesis. Okay, so diapedesis, we are looking at the white blood vessels, that is neutrophils and monocytes, that pass through the wall to go and line up and start promoting healing outside the blood vessel. So neutrophils and monocytes accumulate at the focus of injury by chemotaxis, which is directional migration of white blood cells. So these that have been attracted within the margins of the blood vessels through margination, okay, there are chemicals that pull them to become attracted or to become attached in that similar fashion to reduce the loss of blood. Then those that will pass through the wall of the blood vessels, which is by process of diapedesis, okay, those then will allow formation of meshwork outside the blood vessels. Okay, so these when the neutrophils and let's say the neutrophils monocytes here, when they pass through the walls of the blood vessels, they start to phagocytose foreign material that might be within these areas. Neutrophils are the first leukocytes, okay, to alive, and have a shorter lifespan. Then monocytes usually arrive at the site within 3 to 7 days after the onset of inflammation. In the tissues, monocytes will transform into macrophages, which have a longer lifespan as they can multiply in the tissue and stay for weeks. So here we are establishing that within in the cellular response, white blood vessels will alive after 6 to 12 hours and have a shorter lifespan. Okay, then to do with the cellular response, okay, so the white blood cells remain there, that is outside the blood vessel there, to clean the tissue of dirty materials, okay, before healing can occur. Lymphocytes arrive later at the site of injury. They function primarily by producing substances that aid in attacking foreign materials. So T lymphocytes will okay. So let us see that one. Okay, so cellular response. The lymphocytes were alive later at the site of the injury. They function primarily by producing substances that aid in attacking foreign materials. So when we have cell response, we're going to have T lymphocytes that will kill foreign cells directly or do so by releasing a variety of lymphokines, or lymphokinase, which will enhance the activity of phagocytic cells. So the T lymphocytes are responsible for delayed allergic reaction and the rejection of foreign tissue. Okay, foreign tissue or reduction of tumor cells. Then there is response by the cellular cells. Okay, then there's response by the plasma cell. Okay, so now this is the perspective that we need to understand that we have chemotaxis within the cellular response. Chemotaxis tend to attract the neutrophils or and leukocytes to the area of infection, so that the the white blood cells can fight infection. So there's margination, that is attraction of these neutrophils and monocytes to the margins of the blood vessels in order to promote about closure where there is damage. Then the apodesis, we are looking at migration or transmigration of white blood cells through the walls of capillaries, okay, to an area of an injured tissue. Okay, to an area of an injured tissue in order to promote repair and engulf foreign material. So neutrophils, monocytes will accumulate, and that is at the focus of injury by chemotaxis, which is the directional migration of white blood cells. Okay, so it's important to know that within the cellular response, the neutrophils are the first leukocytes to arrive at the site where there is this noxious substance that may bring about inflammation. Okay, and then after neutrophils are the first leukocytes, okay, to arrive. Then we need to understand that they arrive about 6 to 12 hours, okay, after the injury, and have a shorter lifespan of about 24 to 48 hours. Then the monocytes usually will arrive at the site within that is within 3 to 7 hours days after the onset of inflammation. So monocytes are coming in necessarily after inflammation has set in. So they arrive 3 to 7 days after the onset of inflammation. In the tissues, the monocytes transform into macrophages, which have a longer lifespan as they can multiply in the tissue and stay for weeks. So when monocytes, as they are moving to the area where there's an injury, and then when they become stationary at the site of injury, they become macrophages or transform into macrophages that have got a longer lifespan. Okay, so then after that, then the response now has to do with the lymphatic system responding to the noxious material, or that lymphocytes also have to respond to the foreign material that is within the body. So these lymphocytes arrive later at the site of the injury. Their function primarily is producing substances that aid in attacking foreign materials. T lymphocytes kill foreign cells directly or do so by releasing a variety of lymphokines or lymphokines, which enhance the activity of phagocytic cells. So the presence of lymphokines or lymphokines enhance the activity of phagocytic cells, cells that engulf bacteria. So the T lymphocytes are responsible also for delayed allergic reactions, rejection of foreign tissue, or destruction of tumor cells. Okay. Then from this again cellular response, we also have the B lymphocytes. Okay, that are capable of differentiating into plasma cells. So plasma cells in turn produce what we call immunoglobulins or antibodies. So these are protein molecules that will destroy foreign materials by several mechanisms. Okay, then apart from this B lymphocytes and uh, lymphocyte response, we also have humoral immunity response in the um, inflammatory healing process. So in the humoral immunity, we mostly talk about eosinophils and basophils that have a more sensitive role within the process of inflammation. So they function in hypersensitivity, that is eosinophils, and then basophils produce and store histamine and other substances that are involved in hypersensitivity reactions. So from chemotaxis, where we talked about the diapedesis, margination, okay, and the cells coming to the area, then we have lymphocytes, okay, that responds to the infection or noxious material. Then we also have the humoral immune response to this noxious substance. Okay, so with that mentioned, then we can now appreciate the third phase, which is cellular healing. Cellular healing is about repairing phase. So the reparative process or the repairing process begins at approximately the same time as the injury, and it is interwoven with the inflammation. Healing proceeds after the inflammatory debris is removed. Healing may be regeneration, in which gradual repair of the defect occurs by proliferation of cells of the same type. Okay, so when there's proliferation of these cells of the same type, we're calling this hyperplasia, as those that were destroyed, or by replacement, in which cells of another type, usually connective tissue, are going to fill in the tissue defect, resulting in a scar formation. Okay, so that is the healing process, and those are the stages of inflammation. Stages of inflammation that we have discussed, we have talked about vascular response, we have talked about cellular response, and then we have talked about cellular healing or reparative phase. So now let us look at signs and symptoms of inflammation. So we can have local and then we can also have general signs and symptoms of inflammation. So some of the local cardinal signs and symptoms is redness, which is caused by the dilatation of capillaries at the injured area, allowing more blood. So when there's more blood in the area, you start seeing redness. Then there's warmth and heat, which is due to increased blood flow to the area, bring with it more heat from central part of the body. Then there's swelling. It is caused by plasma, which is poured in the underlying tissue by extravasation of intravascular fluid. So these are some of the cardinal signs, but we still have others. So redness, warmth, and swelling. Swelling, blood carries with it heat. So we have a lot of blood that comes to the area that has a fallen noxious material that is bringing about inflammation. So we can say it is also caused by plasma, which is poured in the underlying tissue by the extravasation or intravascular fluid. Then the other symptom or cardinal signs and symptom local is pain. This is due to accumulation of toxins irritating the nerve endings and hormones released locally from the nerve fibers and stretching caused by excess fluid in the tissue, which increases as the tendon grows. So pain is one of those local signs and symptoms. Low function, okay, is also one of the local signs and symptoms that we see. It occurs as a result of pain, swelling, or toxin effect on the tissue itself. The patient's natural desire here is to rest and avoid using any part, okay, or any part of the body locally that has been affected. So there is function, there is loss of function. Okay, so signs and symptoms of inflammation. The general one or the systemic signs and symptoms may include general body malaise, loss of appetite. Okay, too much pain affects the hypothalamus. So that's why we have loss of appetite. So there's fatigue, there's fever, cause presence of infection, there's tachycardia, oliguria, or constipation. So these are the general systemic signs and symptoms of inflammation. Okay, so I thought of putting something like a mnemonic for us to remember the cardinal signs of inflammation. And this is from the local signs and symptoms of inflammation using the mnemonic feel. So the mnemonic feel, okay, is coming from the Latin, okay, where it's coming from the Latin where we talk about the cardinal signs of inflammation. So in Latin, there's ruba, there's tumor, there's cara, there's dora, and then there's function laser. So ruba is redness. This is what we saw in the local signs and symptoms of inflammation. There's tumor, okay, in Latin to mean swelling. And then there's cara to mean heat. There's dora to mean pain. And then factionalesa, which means loss of function. Okay, so these can be remembered in the mnemonic field. Okay, of course, in the mnemonic field, apart from having swelling, it is for edema. Okay, so we have rhythma. Okay, so rhythma is due to the vasodilatation that happens when one has got a swelling. So there's pain. Okay, there's pain, there's rhythma, there's edema, then there's a loss of function, L, loss of function. So you can remember these with the same. H is for heat, so feel, pain, heat, rhythma, edema, and loss of function. So these are the cardinal signs of inflammation, and we saw these in when we were discussing the local signs and symptoms of inflammation. Okay, outcomes or sequels of inflammation are some of the things that can be seen, okay, many years after one has recovered from some inflammation of some kind. What are some of the things that can be seen as, let's put it like, bit of, let's put it at it as some minor complications that can be seen, okay, minor results that may be seen after inflammation, not necessarily as complication, some minor results that may be seen after inflammation. So the outcome in a particular circumstance will be determined by the tissue in which the injury has occurred and the injurious agent that is causing it. So in acute inflammation, there are four possible outcomes of acute inflammation. So it can either resolve nicely without a scar, depending on how the injury was. or there can be saturation, or saturation. I'll still expand this, or there can be chronic inflammation. Okay, so resolution is the restoration of normal condition. So resolution may occur if minimal cell death and tissue damage has happened. So in term, when there's minimal cell death or tissue damage, then there will be resolution. Then there can be rapid elimination of causal agents in a resolution, or there is local condition that will favor the removal of fluid and debris, okay, in a resolution. But when we talk about saturation, in saturation, there is formation of pus, there's formation of pathogenic bacteria, okay, which is the pathogenic bacteria is the usual cause of full saturation or formation of this pus. So pus formed by inflammatory exudates, polymorphs, and cell fragments. If pus accumulates, an abscess may form. Okay, then we have looked at acute inflammation and the sequel or the outcomes that can be. Then we can also appreciate the outcome or sequels of chronic inflammation. So chronic inflammation is going to occur if the causal agent is not removed. So there will be cell population in the damaged tissue that will change appearance of this area. Polymorphs will be placed by lymphocytes and plasma cells. Macrophages may form giant cells. Okay, so this is part of the sequel or outcome that can be seen in chronic inflammation. And then other things that can be seen in chronic inflammation is new capillaries that are formed. This is to help divert blood away from the area that has got pathology. We also see fibroblast deposit or collagen that can result in fibrosis. So the chronic inflammation that can be primary with no prior acute inflammatory response. It may occur in conditions that is the sequels. These for chronic inflammation can be seen or may occur in tuberculosis or sarcoidosis. It is can be characterized by formation of granulomas, masses of connective tissue. Okay. Then the common sequels, chronic inflammation, is fibrosis, which is the formation of excess fibrous connective tissue in an organ or tissue in a reparative or reactive process to find that there is a fibrous or excess tissue that is formed. It occurs where there is large amount of tissue destruction, such as damaged tissue, that cannot be regenerated completely by the body. So there you have it. Today we are looking at the process of inflammation. So in looking at the process of inflammation, our objective was to define inflammation types of talk about types of inflammation, explain causes of inflammation, describe the process of inflammation, and state the signs and symptoms of inflammation. We define inflammation as the physiological process by which body tissues respond or react to injury or infection. We stated the purpose of inflammation, that is for protection and also for repair. In discussing types of inflammation, we said there are two main types of inflammation. There's acute and chronic inflammation. So acute inflammation is inflammation that is happening immediately after exposure to a noxious substance. Then chronic inflammation is type of inflammation that takes longer, and there is a different presence of lymphocytes and macrophages that can be seen in chronic inflammation. So chronic inflammation that takes longer to resolve, or that has got a longer duration. So we started that and also made the comparison of acute and chronic inflammation. Making this comparison, we look at characteristics like causative agent, danger cells that are involved, and then onset, duration, and outcome. Then after this, then we discuss the process of inflammation. We looked at the vascular response. Vascular response is just the blood vessels, how they respond to the area. Is that at first there's vasoconstriction, then later there'll be vasodilatation. That is in the fashion that it happens. Then we looked at cellular formation of exudate as also a phase of inflammation. We said first there is chemotaxis. Under chemotaxis, there is margination, there is diapedesis under this, and the cells are going to help in the repair of the damaged tissue. So under cellular, we also discussed that there is also humoral immunity at play. So we have T lymphocytes that come to aid. Okay, so lymphocytes try to fight infection. The B lymphocytes also come in to fight infection. Then there is the repairing stage. Repairing stage here involves formation of the fibrin, fibrous material, collagen, that is that is on the site that has an injury. So there will be formation or scar formation is what happens in the cell healing, or that is in the cell healing stage. So after looking at cell healing, Okay, where with the hyperplasia or build-up of cells at the area that are the injury, we went on to look at signs and symptoms. So we looked at signs and symptoms. We categorized them as local signs and symptoms and also general signs and symptoms. Then, cardinal signs and symptoms of inflammation, we use the mnemonic feel. Okay, feel, that is pain, heat, rhythm, edema, and loss of function. So these are the terminologies that we use. And then we look at some sequel or complications, some minor complications that may come or outcomes that we see in acute inflammation and also chronic inflammation. That has been our discussion for today. So from me, I'm saying thank you and keep studying.